all I was going to say.
Okay. Do you want me to start now?
Yeah, I think I'm excited.
Okay. Okay, well, hi, everyone. My name is Kimberly. I'm an RN, and I'm just going to start with your list of questions that I have. But briefly, I have two jobs as an RN. I am a school nurse for Lake Elsinore Unified School District. And then I'm also a aesthetic nurse, so at a med spa in Newport Beach. So I'm from Orange County in high school, which feels like such a long time ago now. I was in honors classes. I played 3 sports. I had a GPA of like 3.5 to 4.0, depending on the semester. I went to community college first. I went to Fullerton Community College, and then I transferred from there to Cal State Fullerton. If you go to a community college first, oftentimes they'll have like, I don't want to say bridge programs, but they'll have like an agreement with a local university where they will accept you over the incoming freshman to help you transfer to that 4-year university. So that's what I did at Fullerton. I did 3 years at FJC, and then I went to Cal State Fullerton. I was just taking my time. And the reason I did that was because it was cheaper. Like there were private colleges are awesome. And I think that they're, sometimes when I think about like my friends that went there and then did like the sorority thing or did like the athlete thing, they had so much fun and they loved it. But I went just a cheaper route, if you will. So when I graduated from Cal State Fullerton, I didn't have any debt, which was awesome. And I got a bachelor's in psychology. But then I took a year off and I didn't really know what I wanted to do still. And I wanted to do nursing. So then I went the private route and I went to West Coast University, which was awesome. And I love it. But yeah, I graduated about a year ago and I am in debt. I'm in so much debt. And like, I took for granted how awesome it was to not be in debt from Cal State Fullerton. I mean, everything happens for a reason, but currently I'm still like $120,000 in debt, and that's federal loans. And then it's private loans also. And, so I did both. And it's funny when you pay back these loans, they give you a little like, if you just make minimum payments, like you'll pay it off at this year. And mine is 2035. 15 years, you guys. This is so long. Oh my God. And honestly, it's a little heartbreaking. And I'm telling you this just because I just want to be honest and be real, because it's like for one of my loans, the minimum payment is $600. And then the interest on that, it's like I make a payment and then the interest like kicks in like a few days later and it's like $450. So I'm like, so this loan's going down $150 at a time. Like this sucks. So it's definitely something to think about because even if you take out loans and you go to a Cal State or a UC, that in-state tuition is going to be so helpful compared to a private school where it's $40,000 and upwards. Or you can pay it like I do and just cry a little bit every time you look at it. So let's see. So that's pretty much my debt, but then on to the fun stuff. So I love being a nurse. I think it's awesome. I got jobs pretty quickly. While I was in nursing school, I was working for the med spa. So I just transitioned into learning how to like do injectables and like lasers and all that really fun stuff to make people feel good. And then for the school district, yeah, it's an awesome job. Not a lot of young people go into it. But it's pretty awesome and I really like it. And I'm really missing the kids this year. So doing it virtual, it's a little bit weird. But I'll talk about that. So school nursing is When I was in high school, I didn't even know we had one. So it's funny me watching how much I do on this end. So if you're a perfectly healthy kid, you don't need any extra services, support, you don't have any medical diagnosis, you probably won't even interact with the district nurse, but you all have one. But they are the people, if you can remember, who do vision and hearing. You do them in elementary school. You do them at different like marks. You do them at kinder, second grade, seventh grade. Not so much in high school. If you do have a medical diagnosis, the school nurse probably does know about it, knows about the medications. If someone has asthma, they keep their inhaler at a certain place. I am not the person that is in the health office. Those are health techs. I work with them, but their scope of practice is really what differentiates them from me. So, you need the RN to do the insulin injections if you have somebody who's diabetic on campus and doesn't do it themselves. So some high schoolers do. But especially when they're younger, like we do the blood sugar checks, we handle any problems that come that way. There's also a lot of involvement for medically fragile kids is the terminology we use. So if they have they need suctioning, if they need any help with it's called activities of daily living. So toileting or eating or, if they have a G tube or if they need a catheter honestly, it could be anything and anything because all the kids that have medical issues, if they go to school, then we handle that at the school level. And we handle immunizations. Yeah, it's a lot. You have to be very organized. And when it's from a distance, I don't do the daily interaction stuff, which for me stinks because I like interacting with the children, but it's a lot of paperwork, which is the least fun part of the job, if I'm just being truthful. You have
a question because I'm trying to wrap my head around so I understand you're not on each individual campus. It sounds like you oversee each of the techs that are on campus. So what do you specifically do? Would you go to campus if someone needs an injection because you're licensed to do that?
Correct. Okay. So it depends on the school district. I currently have 2 campuses. So on a typical school day, I do go to both campuses. I decide that at the beginning of the year. And it could fluctuate depending on the child, but because I have diabetics at both of my campuses. So theoretically, my day, I would have to be at a campus at a specific time so I could test this individual's blood sugar and give them the insulin if needed, depending on their lunch schedule. So I do go to both campuses, and then my health techs will call me if there is something that arises or they need advice or they're concerned about something. But yeah, I go back and forth to both, which means I have a parking space at both. That was a fun perk. I didn't know I had one before I started this job. And they do that just because I am going back and forth and school parking lots fill up. But yeah, it definitely is. You got to be flexible. You have to be organized and you have to be flexible. Because also another thing that you need to be aware of as a school nurse is, so I have an elementary school and then an elementary school with a junior high also. So a K through 5th and then a K through 8th. And I do have preschools at both of the schools. But preschool tends to be a little bit different depending on the school district. But I still do chat with them and I'm aware of any medical issues that go along with that. But if there's field trips, I have to make sure whoever's going on that field trip, if there's medications needed, if the kid has allergies. Another thing about allergies is every time they transition to a new grade, you need to make sure that teacher is aware of signs and symptoms of that allergy and how to administer an EpiPen or who to call or just protocol. You have to have it over and over and over again. You have to train them. I do a lot of educational teaching for anybody who's going to be around that child that needs to be aware of their medical situation in case something happens. So it's different every year. It just depends on who's got what going on and the level of concern or need that student might need. Another part of my job is IEPs. So IEPs are individualized education plans, and it's a whole team. It's usually a school psych. It's me. It could be a speech therapist, could be OT, could be the teacher, someone at the admin level. And basically, all these people collaborate together to help this child in the educational setting. And my role in that is, checking how does their medical or their physical needs affect them in an educational setting. So, I check their vision and their hearing, and I go through the whole assessment and chat with the parents. Do you have any concerns? Because ultimately, as a school nurse, like, healthy kids learn better. Just bottom line. They can't see the board at a practical level, then they're not gonna know. They're not gonna learn. If their diet's off, if they have like an undiagnosed something or other, that's also going to affect them. Like, you really do need to make sure all these students are healthy physically and mentally. So mental health has been an issue that's been coming up a lot, and how we can provide support this year, especially for like junior high kids where the hormone fluctuations start happening, or even younger, because they can experience lows as well. When little kids don't get to go see their friends the way that they used to be able to, sometimes they also get sad. So it's a very interesting job, in my opinion. Let's see. What advice? Okay, this is advice that I would tell myself if I was back in high school. I have found that counselors and admissions people tend to not always be the nicest, and that's okay. However, you don't have to listen to them. If you want to try something and they're telling you like, "Oh, don't waste your time, like you're not going to get in, or this isn't going to help you," like, that's one person's opinion. Like, yes, they are knowledgeable, but also if you want to go to a school or you want to enter into a program and you're not the typical traditional fit for something, that just try anyway, because they could be wrong. And then also just be prepared and thorough on your end as a student. If you're going to a professor, if you're going to an admissions counselor or anybody, just have all your ducks in a row, and don't just show up and just not really have the questions that you need answered or seem unprepared, because then they're really not going to help you. If you choose to go to a private school, this is something that I noticed that was different from like my Cal State experience versus private school. Private schools, it's your money. You are paying tens of thousands of dollars to attend this school. They are there to help you. If they tell you, this just happened to a coworker of mine who's getting her master's. So she turned in something, and so I could be her preceptor, and she didn't put her name in the right spot, and then her application was incomplete. And then they told her like, "Oh, you have to wait till the next term. Like, sorry, you can't participate." And I was like, "No, absolutely not. Like, go back and have them change that form. That's ridiculous. You have to sit out an entire 10-week term because you didn't fill out an application because it was something minor and her name was already on the form." I know this is a very specialized thing, but I'm just telling you as a student, if you are paying, you should question that a little bit. Don't just accept it and take the term off. She questioned it a little bit, and she was able to they fixed the application, and she was able to take her class. And I just think like Cal State's probably won't do that. They probably will be like, "Sorry, too bad." But if it's at a private school, there's a little bit more leeway for stuff like that. Does anybody have any specific questions about like my other med spa job, or anything else about like an RN at a school district or anything like that? No?
Yeah, so what made you choose like being an RN in a hospital rather than, being in a school setting or an IP?
Yeah. Well, when you are a new grad RN and you don't currently work in a hospital as like an LVN or an MA or even just like a unit secretary or something like that, you have no experience. And they have something in hospitals called new grad programs, but they're typically twice a year. And that being said, depending on when your graduation date is, and then when you pass your NCLEX to become, which is the licensing test to become an RN, you have to wait for that cycle, which is a little weird. So when I graduated, and then by the time I took my test, I was ready to go. I was like an RN in September. But most cohorts for that new grad program in hospitals start in August, and you have to apply earlier in like the spring. So my options were wait for like the applications that would be like in November for the spring date for the new grad residency to start, or start at the school district, was started in January. So I started a little bit earlier. When I was in nursing school, how nursing school worked for me was we did like typical classes, right? But we also had terms where there's a public health term. And my public health rotation, I worked at Santa Ana Unified, and I was exposed to like what the school nurse did at that level. And so that experience qualified me to apply for a school nurse job, which was very cool. And I didn't have to wait 6 months to get a job afterwards. But if you work during nursing school or during med school, or I don't know, whatever, law school, if you do something before and you get experience, and then you can just transition into like your new title, then that's awesome. I know a lot of other people in nursing school in my cohort, they worked as EMTs or they were LVNs, and then they were just doing the RN program so that they could still kind of work in their same workplace, but just, get paid more, have that other title type of thing. So a lot of them just transitioned. So yeah, and the thing about nursing is I could still go and work in a hospital at some point. I'd still have to do that new grad program, but that's okay.
So I typed in the chat a couple questions. Do you have to be an RN to do injectables? And then also, how was it taking the NCLEX?
Yes, you have to be an RN to do injectables in the state of California. But you have to be under the practice of a DO or an MD. So even if you're a PA, you need a doctor, and practicing, you would need a doctor saying like, yes, she is like cleared to practice, and also an NP. So, and then with the med spa is interesting because like, if I have a new patient coming in, they have to be cleared by the doctor before I can perform like any of the procedures on them. So, that's just the health thing in California. I know in other states that's not the same. You could probably practice, injectables as an RN elsewhere. I haven't looked into it. I do know in Georgia, you have to be a PA or an MD or DO to do any of the cosmetic stuff, injectables. They don't allow RNs to practice that there, which, okay. I don't know why. And then the NCLEX. Anytime that there's like a scary big test that you have to take, it's never fun. It's stressful. The NCLEX, for those of you who don't know, is it's called an adaptive test. So it ranges from 75 questions all the way up to like 300 questions. It's a big range. So basically, the better you're doing, the harder the questions are going to be. And if you get a question wrong, it's going to ask you about that same concept in a different format or a different type of question again and again until you get it right. Or if you keep getting that same concept wrong, the test will just be like, okay, they don't know it. And then they'll move on to the next one. So it's a little stressful because if you're getting everything right, then you don't get a question number 76 after 75, it'll just shut off. And then you're like, well, I either did really well or I failed. So that's a fun little game. And you have to wait a few days to get the results. So it doesn't just tell you right then. And then if you go past 75 questions, then you're panicking a little, because then you're like, oh, great. So I got some stuff wrong. Like, awesome. Like, how long is this going to go on? So it was stressful, and it was not fun waiting. And they make you go to this weird like testing center where you can't talk to anybody and you can't bring anything in, and it's super strict rules. And I know they do that for like other testing. It's kind of like when you take the standardized tests at school, like it's very like there's like protocol to follow, but this is like even worse. And like then you've done all this work and you're like, oh, what if I fail? And then you have to like wait a certain amount of time before you can attempt to take it again. And yeah, it was not fun. I'm glad it's over and I don't want to take it again. It's a lot of information.
When you look to the future, what's your ultimate goal in nursing, if you have one? Like, where would you ideally like to be? What would you like to be doing? Because there's a whole range of host of things that you can do as an RN, obviously.
Oh my gosh. Yeah, there's so much. I'm still trying to figure that out. I really like pediatrics. So if I did, well, for my job, for a school nurse, I need to be credentialed. So currently I have a certain amount of years that I can continue practicing under my like temporary credential before I have to go back to school. So at some point I'll go back to school and then I might go further and become an NP perhaps, but I don't know. Cause it's just so, honestly it's difficult to assess. Cause I could go work in an office. I could go work in the hospital. And then what department in the hospital? Medicine's super cool because there's so many different avenues to choose from. But because there's so many different avenues to choose from, sometimes it's harder. Sometimes it's hard to choose. However, when you do specific rotations, you find out what you don't like, which is very helpful. So I can tell you what departments I would never work in. Just personally, it just like was not good for me. I don't like a skilled nursing facility. I had never really been in one before, and I do not like them. It's too routine. So anywhere I think where the patient is like living there and then is just there day after day after day, I personally don't think I would find fulfillment there. I like it when it's new and every day has something a little bit different going on. So yeah, I don't know what my ultimate goal is. I'm still figuring that out. Sorry.
Maybe in the ER you'd get a lot of that.
So actually, the ER is pretty routine. I'm not gonna lie. Yeah, as a nurse, because it's the same protocol. Like the patient comes in, you do a quick head to toe assessment, you start an IV, like you get their stats. It's like the same. And honestly, in the ER, people are smelly. You guys, the smells are ridiculous and people are dirty. They're so dirty and just vomit and dirt, and there's a lot going on in the ER. It's not as like glamorous as people think. And people screaming. People love to scream in the ER. That's fun. It's usually pretty tight quarters. They don't need to scream. You can hear them. But yeah. Any other questions I can answer? Specifics?
Yeah, so you said there are things that as a nurse you can and can't do. Is there anything that you need like authority to do? And is there like a doctor you're under in your school district?
No. So with every medical provider, you have what's called a scope of practice. So there's nothing I would be doing in a medical setting that would need the approval of a doctor, or would require me to do. So like to have a doctor on staff. So for every medication that I administer, I have to review a doctor's order. I cannot give anything that isn't brought to me by the parent or guardian of that student with that medication that is written by a doctor that says, give this at this time to this student. I do follow doctor's orders still in the school setting, but there isn't really anything that would require a doctor to be on staff or to be at a school site for that, because the RN scope of practice allows it, type of thing. In the med spa setting, a lot of it has to do with, yes, knowledge of what that patient is like experiencing at home, like if they're on specific medications, but a lot of it has to do with like needle depth. So the type of injection that RNs can do versus like an LVN, it has to do like, okay, there's different type of injections. There's like superficials, there's IM, which is like intramuscular injections that you can do, and only an RN can do that. And it has to do with, if you go that deep, then it can affect the bloodstream quickly. And the RN had more like training, education, that they would know which medications to administer and what the signs and symptoms of that medication would be, and if it had like effects on the patient, if that makes sense. So I hope that kind of helps with the scope of practice and like how that affects like what orders people can and cannot follow. If you're a doctor, you do everything. You make the orders and people follow what you say. And then the NP has a lot of autonomy if you want to be like an advanced RN, is what's essentially what an NP is. But they follow what the doctor above them would do. So think of it as almost like they're following a template that like they know that the doctor that is like sponsoring them would prescribe this medication in this setting. They can't just like prescribe anything that they want when they want. They have to do what that doctor would do, if that makes sense.
So is that doctor giving the orders and they're just carrying them out basically? They're not making those decisions on their own?
The NP?
Mm-hmm. Yes.
Correct. Well, I mean, they are making it. They have what's called, okay, so when you are prescribing medications, because NPs can prescribe medication, you have an NPI number, which basically means that you have authority to prescribe that medication. Mm-hmm. But you have to use the medications that the doctor would use themselves.
Got it.
So you can't just like be like, I'm going to do this. And the doctor would be like, no, you cannot. Type of thing.
So you're basically training under them based on their philosophy and what the way that they would treat somebody in the same manner.
Correct.
Okay.
Correct.
So guys, we have about 1 minute. Does anybody else have any questions?
Okay. Oh, we have something. I don't know how to read this. Sorry, I'm not like Google Meet savvy. We use.
That's okay. It says, I'll read it to you. It says, a couple of weeks ago, my nurse administered a vaccine incorrectly, and I had to go to the ER to get treated for an infection and a torn blood vessel. How much trouble do you get in for that? That sounds bad.
Well, I'm sorry that happened to you, first and foremost. Well, I don't know. I guess I'd have to be with more specifics. And again, RNs are not operating by themselves. So they're under a doctor. So I think it would be not up to the discretion of the doctor, but I think the doctor would be the one to investigate exactly what happened and kind of go from there. But I don't know that I don't know what the consequences would be. But I'm so sorry that happened to you.
Any medical provider has malpractice, which and any attorney or anybody in a profession in that manner, they would have malpractice insurance, so that if they were sued for something they did that was out of the scope of their job, or it was negligence or something like that, that's what they would have insurance for. California is a sue happy state, so they need a lot of insurance.
A torn blood vessel? I'm so sorry.
It sounds like the person didn't know what they're doing.
Yeah, like, I mean, there are specific injections for like specific like anatomy. So I wonder what vaccine you were getting, like in your arm, or like I don't know where they were giving it to you that would tear it. I'm sorry.
Yeah, when my mom was alive, she had what the nurses called rolling veins, and
Oh,
it was really hard to draw blood from her.
yeah, that is difficult. There's a lot of things. We used to joke in nursing school, and still kind of now, like that. Nurses are problem solvers, and it's all about plumbing. So, really finding a vein, there's all these different tips and tricks that you can like try, right? So veins have valves, and so you really have to be cognizant of like how long is your needle. Where is the tip of your needle? Did the blood stop flowing? Is it because there's a clot, or is it because you're bumped up against a valve? Did it go through the vessel? Like, there's a lot of like stuff. Rolling veins does not help. But they have what's called vein finders. And if you guys don't know what that is, you could Google it. But basically, it's like a lamp that you put over someone's arm that will give you like a roadmap, like of the person's veins, which make it very helpful to start an IV. But yeah, there's all kinds of tips and tricks. I hope that answered your question.
Thank you so much. Does anybody else have another question? We're a little bit over, so I don't want to keep you too long. Jason, do you want to close?
Yeah, I'll close. Thank you, Kimberly, for meeting with us. It was a pleasure having you. That's it. I'm just gonna release everyone. So thank you all for coming. Yeah.
Okay. Bye, you guys.
Thank you, Claire. We really appreciate your time and being here and taking out time to educate us on what you're doing. And good luck to you.
Oh, thank you so much. I appreciate that.
Yeah. You're just now starting out. You've got a long ways ahead of you of the things that you're going to end up doing. I know it.
Oh, thank you. I appreciate that. Okay. Bye, guys.
Bye, guys. Thanks for coming.